this hospital open, not only for all of our members that we represent, but for all of the community. It's very important to have this hospital stay open. As Maureen mentioned, I do want to thank Governor Wolf, I do want to thank Mayor Kinney, and I also want to thank Senator Bernie Sanders for standing in solidarity with us today. And certainly, last but not least, I want to thank all of our members of District 1199C who are out here in this fight. Our union has never been scared of a fight. We've never been scared to push back, and we're going to continue to do that. So we're calling on everybody to stand with us to make sure we keep this hospital open. Let's go, let's stay strong, and let's stay together. Thank you, God.
Okay, go ahead. Keep it open. Okay, our next speaker, who I'm very proud of as well, Susan Bowes. She's the president of the Hahnemann Nurses Association. And if ever there was a time to lead, this is the time to lead, because I know that Susan Bowes has shouldered a lot of the grief and a lot of the troubles, and she's also been the rock for every nurse and any other healthcare in this person in this hospital. She's been there for them. She's a wonderful leader. She's a great colleague, and I'm proud to have her as part of PASNEP and the president of Hahnemann.
Good afternoon. My name is Susan Bowes, and I am the proud leader of the Nurses Union, PASNEP, here at Hahnemann. I want to first thank all of you for coming today, especially my brothers and sisters from PASNEP locals around this city, 1199, and my colleagues here at Hahnemann. We are here again today to do what we always do: advocate for our patients. This storied institution has cared for patients for 170 years. Our patients depend on us to be here for them, and we plan to continue to show up and fight for them. Just last week, a patient asked one of our resident physicians, "Where will I go if this hospital closes?" The resident said, "You can go to Temple or Jefferson." The patient, fighting tears, said, "Jefferson doesn't take my insurance, and Temple is too far." In a city with one of the highest poverty rates in our nation, with rising gun violence and the opioid epidemic, the closure of Hahnemann Hospital will cost people's lives. This is the sad reality for the patients we care for every day. Our emergency room sees 40,000 to 50,000 patients per year. The wait times in all the areas, ERs in Philadelphia, are well beyond the national average. People will get sicker waiting for care. This is a public health crisis. Healthcare is supposed to be about healing. The coward owner who owns this hospital knows nothing about that. He doesn't care about the over 800 pregnant mothers who are now scrambling to find a place to deliver their babies. He doesn't care about the 571 residents now orphaned and held hostage, not knowing if or when they will continue their education. He doesn't care about our city, our patients, or us. The only thing he cares about is his bank account. We cannot let him destroy us. Healthcare is a human right, and we need to defend that right against vultures like Joel Friedman, who consider closing a hospital a real estate deal. Thank you.
Okay, keep it open. There's one person here that will be speaking from Council Member Kim, who has been a staunch staunch supporter of PASNAP. She has been in the background and in the forefront of making this hospital stay open, and as well as Medicare for all and also people's rights. That is Helen Gim. She's coming to speak with us now.
All right. I want to hear you make enough noise that Joel Friedman can hear you in his condo. So let's make it clear. Today, the eyes of the nation are on Hahnemann Hospital right now. They're on the 50,000 patients whose lives and care hang in the balance. They're on the 3,000 workers whose grief, anger, and refusal to stay silent have moved a state to action. They're counting on all of us to stand up in this moment and not treat it like it's inevitable and not treat it like it's okay for private capital to come in like this. And they're counting on us to fight like hell for our city. So make no mistake, this is a public health crisis, and it's a disaster that can only be created by man-made failures. I want us to think about this for a moment. How corrupt is it for an investment banker and a real estate company to come in and buy a major medical hospital here in the poorest large city in the country? Are we going to let that be okay? Hell no! Hell no! How wrong are our laws when Joel Friedman and his cohort of vulture capitalists run this hospital into the ground in less than 18 months, and they're going to flip it for a real estate deal? Are we going to let him do that? Hell no! And how weak, I'm with you. And how weak are our politics when Joel Friedman can get away with closing down an emergency room in less than 72 hours and then tell 800 expectant mothers they have to find another place to give birth? What do we have to say to that? Hell no! Say it louder, folks. Shame! 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 So Governor Wolf, I want to thank Governor Wolf for the $15 million he put in with the city of Philadelphia. It's a start, but I'll say right now it's not enough. It's time for you to get out of Harrisburg and come down to our city. We are your people. This is our movement. And our city needs you to be with us right now. And this is why. Because, let me be clear, across the state of Pennsylvania, there are 48 other hospitals in worse financial condition than Hahnemann right now. If we let Hahnemann fall, if we let Joel Friedman and the private equity and Wall Street take over our most important institutions, don't think that the rest won't follow. And elected officials will get the signal that it's okay to be on the sidelines. But no more. No more. This is our line in the sand. This is for every mom about to give birth, for every cancer patient fighting for their lives. This is for every young person walking through these streets. And this is for every worker who shows up each and every day doing more with less. We've got your back. You are not alone. This is what we're building, and we're not going to stop here. We are here to save Hahnemann, and we are here to save our city. Whose city? Whose hospital? Whose lives? Keep it open.
We are very blessed and fortunate to have the support of legislators. And one of the legislators that are here will be coming out soon, but we have to hear from our patients. So one of the most important commodities, as Joel would say, that is affected are our patients. So I'm going to have a patient speak. She spoke last week. She's going to be up here to tell us her experience, because we all know this is a human right and this is a humanitarian fight, and we're going to have it from the patient's heart. Maria Garcia.
Thank you, Dylan, and thank you, Senator Sanders, for inviting me to be here today. My name is Maria Garcia Bulkley, and I have been a pediatric physician assistant for almost 25 years. Since 2008, I have worked closely with an underserved patient population in North Philadelphia that suffers not only from healthcare disparities, but also from debilitating poverty and food insecurity. Although disenfranchised, they strive to have a voice and have inspired me to understand what happens when healthcare is not considered to be a human right. In February of this year, I was diagnosed with stage 4 non-Hodgkin's lymphoma. My oncologist, Dr. Renee Rubin, recommended an aggressive chemotherapy regimen of 6 monthly cycles, each requiring a 5 to 6 day hospital admission at Hahnemann. I completed my 5th cycle last Friday. At first, I was reluctant to be a patient at Hahnemann. Since I work for St. Christopher's Hospital for Children, also owned by American Academic Health Systems, I was quite familiar with the upheaval at both hospitals, and this caused me to question whether or not becoming a patient at a hospital undergoing such stress was a good idea. My oncologist, however, reassured me that my care would be excellent. I trusted her, and she was spot on. I have worked closely with nurses and nurse practitioners throughout my entire career, and the team on 15 North is the best I have ever encountered. Not only have they performed their jobs with grace and professionalism in the face of uncertainty, but they have also become a second family to me. And the excellent care I have received at Hahnemann Hospital runs the gamut from admissions to transport to housekeeping to dietary to engineering to the PCAs to the nurses and nursing supervisors, to the pharmacists, to the physicians, including the medical students, interns, and residents. It has been a complete package of focused patient care. Unfortunately, this package is now in danger of being dismantled, and that is a disgrace. The city of Philadelphia cannot afford to let this hospital close. It is a crucial institution, a lifeline that so many people from all walks of life depend on for health care, for employment, for training, and for a sense of community. And I too would like to depend on Hahnemann Hospital to remain open, so I may complete my treatment in August in the care of my second family on 15 North. In closing, I am calling upon Governor Wolf, Mayor Kenny, all city council members, the administrations of all hospitals and medical schools in and near Philadelphia, and all city-affiliated healthcare industry professionals to vigorously work together to save Hahnemann Hospital. Not only by finding a way to fund hospital operations until a buyer is found, but by doing whatever needs to be done to restructure the organization in a sustainable way, so it may continue its work of sustaining so many others who depend upon it. Thank you.
I'm back. Okay. As I said, we're very lucky to have very important legislators. And who helped make this happen today is Senator Nina Turner. Louder. This is who made it happen for us today. Senator Turner said to me today, you're doing the grassroots work, and we are the grassroots right here. But we have to give credit to the folks that make it happen. Thank you.
We're going to give it up for the president right here. She don't know. I heard her slip and call me Tina.
I'm sorry. I corrected it. I did say Tina.
But it's a beautiful thing because when I think about one of Tina Turner's most famous songs, what's love got to do with it, baby? Everything. That's why we are here today, because love has everything to do with it. I want us to pause for a moment to reflect on what our sister Maria had to say, because Maria represents all of the patients who get their care at Hahnemann Hospital right now. Maria is the essence of why we fight. What's love got to do with it? Everything. Philadelphia, we pause today to let you know that we are here because you are here. We are here because the struggle is here. We are here because the needs are here. We are here because the people are here. We stand in solidarity with you side by side, an ally in the fight to keep this hospital open. Philadelphia, you are the canary in the coal mine when it comes to putting this country on notice that it is a sin and a damn shame that in the United States of America, that any city would have to endure the notion that your hospital will shut down because somebody wants to make their profit on the backs and the necks of the people. We are here because you are here. And when the rainbow mosaic of humanity stands together side by side, we are the biggest force in the universe. We stand strong and tall for what is right, for what is just, and for what is good. Health care should never be commodified. We are here because you are here. And I also want to share something that President Woods laid out when I had a chance to talk to him about his union and the workers who serve the patients at Hahnemann Hospital, from the hospitality workers to the tech workers. It's all of us together. And sisters and brothers, I want you to know that if this hospital closes, those workers may lose their pension. It is a sin. It is a sin and a damn shame. The immorality of folks who don't understand that the lifeblood of any city, the lifeblood of a nation, wraps itself around those industries that are designed to serve the people. And Hahnemann Hospital is one of those institutions. We are here because you are here. And I want you to make no mistake that the other side may have more money, but baby, we got the people. People power all day long. And we are fortunate to have in the leadership of Senator Bernie Sanders, who continues to be wherever the needs are, who continues to be wherever the people are. We are here because you are here. I want to fulfill a request before the senator comes up. I had an elder in the audience ask me to tell the three bones. And Philadelphia, I want you to wrap your mind around these three bones: the wishbone, the jawbone, and the backbone. The wishbone will keep us hoping and praying because hope is the motivator, but the dream is the driver. The jawbone will give us courage to speak truth, the power to lift our voices. You see, titles are good, but purpose is better. But the most important bone of them all, the supercalifragilistic expialidocious bone, is the backbone, because the backbone will keep us standing through all of our trials and our tribulations. And in this life, we gonna go through some stuff. But we can't have a testimony without a test. And speaking of backbone, I bring to you the senator that has stood in the ready position for the people, not only of the great city of Philadelphia, but all over this country, demanding that Medicare is a human right. He is our champion, and he stands in solidarity with you. Sisters and brothers, put your hands together and let's welcome Senator Bernie Sanders.
Thank you. Thank you all. Let me begin by thanking the doctors, the nurses, and all of the staff at Hahnemann for their dedication and for all of the great work they have done year after year after year for the people of Philadelphia. And I want to thank the trade union movement, PASNAP, 1199C, and the other trade unions for their determination to keep this hospital open. Damn right. And I want to thank the elected officials, the governor and his administration,
the Attorney General, Mayor Kenny, and the City Council for all of their efforts. And I especially want to thank Maureen May, Chris Woods, Sue Bowles, Councilwoman Helen Jim, and our courageous patient, Marcia Garcia, for their wonderful words. And I want to thank all of you. This is a great turnout in a mid-afternoon. Thank all of you very much. The issue that brings us here today is not complicated. At a time when our country faces a major health care crisis, when 80 million Americans are either uninsured or underinsured, including tens of thousands of people here in the Philadelphia area, we should be moving, we must be moving forward to guarantee health care to all people as a right. And we should not be talking about shutting down a major hospital and converting that property into hotels or condos or some other real estate opportunity. This is not a complicated issue. It is a question of getting our priorities right. Providing health care to the sick, the elderly, the vulnerable, working families, and the poor is more important than huge profits for an investment banker. This is not a question of economics. This is a question of basic human morality. So today we send a very loud and clear message to Mr. Joel Friedman. The investment banker from Los Angeles. And that message is as simple as one can imagine, and that is, do not shut down this hospital. Work with local officials, work with the unions and the people of this city, and keep this hospital open. In Hahnemann, we are talking, as all of you know, about a hospital that serves some of the most vulnerable people in this city, 2/3 of whom are people of color. We are talking about a hospital whose emergency room sees 50,000 people each and every year. Many of them, by the way, sicker than they should be because they don't get the primary health care that they need. We are talking about a hospital that employs 2,500 dedicated workers and 500 medical residents. We are talking about a hospital that has been a major part of the social fabric of Philadelphia since before the Civil War. You know, we got to be honest. And when we talk about what is proposed here, we have got to ask some very hard questions. And one of those questions is simple and straightforward. How many people will in fact die if this hospital is shut down? And we say human life is more important than corporate profits. Disgracefully, as all of you know, we have an infant mortality rate in this country which is much too high, and we ask, how much higher will it become if this hospital is shut down? At a time when the mortality rate for women giving birth, especially African American women, is much too high, we ask, how many more mothers will die if this hospital is shut down? As all of you know, the possible closure of Hahnemann has nothing to do with health care. It has everything to do with greed, corporate greed. It is about a national health care system in America which is dysfunctional because its goal is not to provide health care to all people as a right, but is to make as much money as possible for the insurance companies, the drug companies, and in this case, real estate speculators. That is wrong. That is immoral. That is not what this country is about. We believe that health care is a human right, and we're going to fight for a system that is based on human needs, not corporate profits. Health care is not a commodity to be bought and sold to the highest bidder. Health care is something that every person in this city, in this state, in this country is entitled to because they are a human being. In the immediate moment where we are right now, we stand in solidarity with doctors, nurses, community groups, and local elected officials who are fighting to save Hahnemann from being destroyed by a real estate speculator. But what we must also understand is that this is not just a Philadelphia issue. It is not just a Vermont issue. It is a national issue. Since 2010, over 100 hospitals in the United States have shut down, and if we do not get our act together and put people before profits, hundreds more will soon be shutting down. Make no mistake about it. If an investment banker like Joel Friedman is able to shut down Joel Friedman is able to shut down Hahnemann and make a huge profit by turning this hospital into luxury condos. It will send a signal to every vulture fund on Wall Street that they can do the same thing in community after community after community. We cannot and we will not allow that to happen. And that is why I will be very soon introducing legislation in the Senate to establish a $20 billion emergency trust fund to help states and local communities purchase hospitals that are in financial distress. In my view, anytime a hospital is put up for sale in America, the local community or the state must have the right to buy it first with emergency financial assistance. And I'll tell you what else we're going to do. We're going to end private equity funds from Wall Street vulture from owning hospitals in the first place. And I'll tell you what else we have got to do, and that is the United States must do what every other major country on earth does, and that is guarantee health care to all through a Medicare for all single-payer program. On the Medicare for all, we are going to invest in health care facilities that operate in underserved areas, and we are going to end the culture of corporate greed that is denying health care today to tens of millions of Americans. All of you just heard my good friend and colleague, Senator Nina Turner. And Senator Turner has quoted now and in the past the great abolitionist Frederick Douglass, who said, "Power concedes nothing without a demand, without struggle." And today, we are demanding that Hahnemann remains open. And we are demanding that health care in this country is a right and that people are entitled to go to first-rate hospitals in the communities that they live. Brothers and sisters, this is not a difficult issue. The function of health care must be to provide quality care to all people regardless of their income. The function of health care is that anybody in this country, urban America, rural America, should be able to walk in to a doctor's office when he or she needs that care. The function of health care is to make sure that prescription drugs are affordable and that the pharmaceutical industry does not continue to rip off the American people. Now, the insurance companies, the real estate speculators, the drug companies like the status quo. But we've got news for them. That's not what the American people want. The American people are clear that they think health care belongs to all of us in a non-profit way. So our job now, here in Philadelphia and Vermont and all over this country, is to make it clear to the insurance companies, to the drug companies, to the real estate speculators, enough is enough. We are going to create a Medicare for all single-payer system. And we are going to protect the great hospitals in Philadelphia and throughout this country. Let us stand together. Let us not allow Trump and his friends to divide us up. And when we stand together, we will guarantee health care to all people as a human right. Thank you very much.